All right. All right, I believe we are all set to go. Guys, good morning. Happy Monday. I hope your Easter weekend was great, that you were able to spend time with your family. I know we've been doing a lot of that recently, which is great. But just hope that you guys had a wonderful holiday. What I want to do is to get into, just to kind of start where we started on Friday, just to introduce what we're doing now. This is our second town hall for the fashion industry here in Austin. We really felt like this was really important for us to discuss what's going on in light of COVID-19 in the industry locally, as well as what's happening kind of in larger macro trends throughout the industry. We wanted to also talk about ways that we're trying to engage more with the community and look for the things that you really need from us. So we really want to look at what are the actual needs and how can we meet those. Again, what I wanted to do is just introduce myself one more time. My name is Nina Means. I'm the director for ACC Fashion Incubator. We are a brand new program that was initiated through the interlocal agreement between ACC, Austin Community College, Gerber Technology, which is a longstanding technology company for apparel, automotive, aviation, does a variety of different industries, but we use it primarily in the apparel industry for digitizing patterns, for doing automated cutting processes. It just really speeds up the entire supply chain for the fashion industry. So we use that technology. And then we also came together with the City of Austin Economic Development. And so a lot of that is really where we were able to, we were brought together to solve an issue where we had a lot of small emerging businesses here in Austin, a burgeoning industry that needed some additional support. And so what we were able to do is to bring a high technology solution to emerging startup businesses and to really help those businesses grow. So that's something that we've been laying the groundwork for a very long time, or what feels like a very long time on our side. But what we're looking forward to do is being able to bring that information and those resources to the local fashion industry and that local fashion community to really help get you over that hurdle of product development, to get into production and to be able to meet the consumer demand for your product. What we wanted to do was I wanted to give you a little bit of my own background. My career originally started in public health. So I used to work in international health in Washington, D.C. prior to switching my career into fashion about 10 years ago. So I studied in Italy, I studied in New York, I moved back to New York City to work as a designer there. And when I moved to Texas almost 5 years ago, it was something where I got a chance to start my own company, my own brand. And I saw firsthand how challenging it is as an emerging designer, as an emerging business, whenever a large brand or large business isn't behind you trying to create product for your customer. It's hard. And so as we recognize that, what we're trying to do is to provide those resources to you directly that are going to help you get your business to the next level. So it's really important to us to be able to connect with you, to hear what you're struggling with, what you need help with, so that we can appropriately address those needs and help you to get you to the next step. So I just wanted to kind of reintroduce the program and help you guys understand why is it that we're here, what is it that we really want to do, and in this new environment of COVID-19 and social distancing and virtual delivery, we really want to look at how do we help you in this space reach your customer in a new way? How do we help you show that you are being sustainable, that you are, a lot of large businesses that are failing now. And this is an opportunity for small business to step into those spaces where these huge businesses used to be. And I said, absolutely. This is really a story of inspiration and an exciting place for small businesses to be, where large businesses may not be able to shift and move as quickly as they need to. So we'll be talking more about those things in the future. Just as a quick reminder, we are all working from home. I'm a mom, and so, I'll be keeping my eye on my little one. So just know that, there may be some quick adjustments that need to be made. And so, but I am here and we're talking. This is a 30-minute call. We're going to do the full 30 minutes. no matter what. So thank you so much in advance for being patient with both of us as we navigate this new space together. It's really nice to have a little extra time with family, but we know that as we're working that there's some additional things we have to consider. So thanks so much in advance for that. So I did kind of talk about just some high-level future plans of the incubator, but what I really want to do is to be able to talk about, as I mentioned earlier, we really want to know what we need to do to help support you. So please email us if you're not already on our email list. Go ahead and actually send us an email to fashion.incubator@austincc.edu, and we'll add you to our mailing list. But we also want to hear what you're working on and what you need. So this is an opportunity for you to engage with us. We're going to pull all of that information together, and we're going to turn out some additional content that's really like topics that are generated from you. So this is an opportunity for you to get your questions answered, as opposed to you sitting down with a consultant or someone else. This is a really great opportunity for you to get that dialogue here with us. So on Mondays, what we're going to do, it won't be town hall anymore in that way. It'll be more like a coffee talk. So we'll have coffee, me and you, and I'll be going through those questions and just answering questions on Monday mornings. On Wednesday, it's going to be our Educational Wednesday time, where we have some planned content that will be available for you, where we're talking about technical design and various things. We've got an incredible team here that I must talk about before I go too much further. And then on Fridays, we're going to do something called ACC Presents. And that's really where we're going to connect with our local community. We're going to talk with emerging designers. We're going to talk with businesses and whatnot. And so this is kind of recapping everything that you can expect from us in this space. So we will see you on Monday, Wednesday, and Friday for just these little snapshots, 30 minutes or less, to be able to talk about different content pieces. Monday, coffee and questions. Wednesday, educational, and then Friday is going to be interviews. So can't wait to have discussions with a lot of you in the community that are doing incredible things. But I don't want to spend too much time getting here. We're already 10 minutes in. We've got 20 minutes to talk about masks today. So we promised that we would be talking about COVID-19 and mask making. So a lot of you sent in questions ahead of time. So what I'm going to do is I'm going to try to get into the mask from materials, design, and fit. And then we're going to answer some questions towards the end. So we'll kind of jump right in, okay? So I want to first make a distinction between masks and face coverings. So the CDC made guidelines to focus on face coverings. So this is really just something that's going to cover, over the nose, around the face, down over the chin, and then it will fasten either behind your ears or you'll tie it behind your head. The purpose of this is while you're doing social distancing and staying at home and following those primary guidelines first, if you find yourself at the grocery store, at Target, or wherever you need to go to get some essential supplies on a limited basis, that in those moments that may last an hour or two, that you have a facial covering that kind of prevents, moisture from getting to your face. So right now, what we understand about the virus is that it's spread through droplet. And so, in some aerosolized, but primarily droplet is what you'd see, sneeze or cough. But it's really only intended for a short period of time. And that's because how the material functions. So I want to talk a little bit about materials. But before I get into that, I want to kind of frame out 3 different risk levels. And so then that way it helps us to kind of frame out how we're talking about the materials and when they're the most useful. So the risk levels are really about, so we want to say at the low risk, this is when you're like outside in your garden, you're like pulling up weeds, or you're, in your yard, you're walking your dog, taking the kid out for a stroller ride, or maybe you're just going on a jog by yourself. You're maintaining social distancing. You're not getting too close to anyone else, but you're out in the open air. This is a low risk experience. Now, a medium risk would be something like you're going to the grocery store or Target, right? Hello. Ooh, favorite person. So, Thomas stopped. There we go. Yay. All right. There you go. Yeah, there you go. You want to sit with Mama? All right. So the medium risk is whenever we're talking about going to the grocery store. And then high risk is whenever we're talking about specialized equipment that's needed for healthcare workers. Really, the only thing that we're seeing that's actually effective in preventing the virus from spreading is the N95 mask. And it's really an N95 respirator. So it's filtered, it's melt blown. You may have done some research and realize that these actually are made through a very specialized machinery, very specialized fiber content, and it's, melt blown and all these very complicated things that companies like 3M and, much larger industry actually put together. Unfortunately, we're finding ourselves in a lack of that. And so instead of us trying to deal with what's effective for healthcare workers in this space, we really are speaking to the community here. And so what we want to do is to focus on what can the community do, and what can we use to be able to protect ourselves the best. And so, so we're not, I'm not a doctor. Working in public health is not being a physician or a physician's assistant or a nurse, but we are aware of, we've been working in a task force with material scientists and circular economy experts and manufacturing experts and Dell Medical. And so I just want to take a minute to kind of recognize some of those people that we've been working with. So Shahram Shafi is the Chief Technical Officer for Green Source. He's on our advisory board at the Fashion Incubator. So what we've really been relying on Shahram for is his extensive network and helping us connect with a variety of manufacturers, scientists, and also just kind of guiding us through the process of being able to vet various materials and activities. We are working with Shahab Sassan, and he is he does a ton of R&D. He's extremely knowledgeable on the subject that we're exploring here, trying to understand the material science behind all of this. And so we've been working with Shahab. We've also been working with Anand Raghunathan, who is a material scientist out of MIT. And so we've really been relying on a lot of our local experts. And then last but certainly not least, Michele French, who's our production coordinator at the Fashion Incubator. She has been a superstar helping us pull together all of these different resources. She's our project lead on helping us understand what kinds of materials are appropriate to be able to utilize for various types of facial coverings, surgical hats, gowning, things like this. And so we've been going through a variety of processes oh yes, Michele French, if you don't mind, it'd be really nice if you could just kind of introduce yourself on the chat so people can see you. But we're really fortunate to have such an incredible group of people. Michele French finished the program at UT, and so she actually is very well versed in material science and has really been a huge help with helping us identify appropriate materials to be able to use. And so as we're fielding questions, a lot of this is really coming from a variety of different places, but what we're going to try to do is stay high level on the science, because really you just want to know, what should I be using? So if any of you are like, please give me more science, we are happy to do so. We love it. We geek out on this kind of stuff. But we understand that, we are in a moment right now that needs to be addressed. And so we need to also provide as much information as we possibly can. So what I'm going to be doing is focusing on low risk and even medium risk levels. The high risk levels I'm not going to address during this talk because healthcare workers need a very specific protective equipment, and that really should be provided at the N95 respirator level. And so a lot of the cotton, does not protect. And that was actually one of you guys' questions that you sent during your RSAP was, the cotton isn't really protective. So why should we be using that? And so what we're going to say is in the low risk space. Do you know what? I left out a couple of people that we have been working with. So Dell Med Innovation has been huge for us. UT, their research and development for material sciences We've been doing work with the city of Austin, and our partners at Gerber have been an incredible support for us throughout this process. They've been giving us digital files and helping us to prepare for using our cutting table, and we'll tell you more about the kinds of things that we're doing there, but I just wanted to make sure to mention them as well. So for low and medium risk, cotton, is really the best thing that we have right now, but it's really something where you're only going to be wearing it for a very short period of time. It's okay when you're low risk. The proper use is really just making sure that, it's been layered up. And what you want to do is that whenever you cut your material, one, you want to make sure the material has a very high density. So it's not open weave like this. You want something that's a little bit tighter. So think about like your difference between like 200 thread count sheets versus like 600 thread count sheets. So it won't be like all quilting material is made the same or all sheets are made the same. Clearly you can tell the difference whenever something has a more open weave. And if you blow through it, you can see your breath on the other side of it, like if you were fogging up a mirror, versus if you were kind of blowing through something that's a little tighter like this. And so you can actually see that there's less opportunity for things to go through them. So what we want to do is to increase the amount of tight connections as it's going over your face. So if you think about it, like if I have things layered up this way, and then I cut another layer of fabric, and now my grains are going this way, now I have even more coverage. And so you want to go at least 2-ply. Some people have been asking about using like a non-woven interfacing. Perfectly fine to do that. Again, this is really for low and medium, exposures. So it's really, you're not going to be wearing it very long, but a layer is a layer. And so it does help. The main thing is that whenever you're wearing it, you don't want to have, some people are layering up so much that they're having a hard time breathing. So be sure that whenever you do your mask, you want something that's got enough distance in your breathing that you're not going to create too much condensation from your breath on the inside. So this is kind of getting into the mask design, but to go back to the material, the main thing is, you want a tight weave, material. So it's not just all cottons are made the same. You want something that has less airflow through them. And then whenever you have those airflow, you want to layer them up. The other thing is in N95 mask, a lot of those non-woven materials have been electrostatically charged. That just means that each thread has been charged, and what it does is it actually captures the virus before it gets to you. And so it doesn't allow it to pass through. It's like a magnet. And so instead of it allowing things to pass through that are small enough, it actually stops it on that layer. We can't really do that because a lot of that's done through like something called ultrasonic welding, fancy term for basically it's not a sewing machine and it's expensive. So what we have focused on in the low to medium risk space, because we're not doing that right now, is really just saying you can stitch it. You're only going to wear it for a short period of time, and you're only going to wear it whenever you're at the grocery store. And as soon as you get back to your car, you're going to take it off. So for people who are like going to be working for 6 to 18 hours wearing a mask, the N95 is ideal, and that's exactly what they need. And if you're going to be, and there are going to be people who are going to have exposure to the virus. But if you're not going to have exposure to the virus, ideally what you're going to want to do is to actually make sure that you don't, that you're not, you just don't want to be in a space where you're exposed to the virus and wearing cotton, because it's not really helping the pass through. So for Jill is asking, high polyester count, okay. We actually encourage you to use the cotton fiber over the polyester fiber. And the reason why we do that is primarily for breathability. The cotton, as well as the fiber, has some properties that are a bit more protective than the polyester. The way that the polyester threads are made versus the cotton fiber are fundamentally different. And so we're seeing that the cotton actually provides more breathability even in short-term wear than polyester. So that's a really good question. So the design, so face coverings, then you got surgical masks that are pleated. You can do a face covering that's pleated. The primary reason why the design is pleated is mostly just to be able to go over the face. So TJ is asking, these are good material questions. I'm going to ask them. I'm going to try to answer them here. So it says high polyester count. Okay. A blend would be better than a full high polyester gel, but I would go for 100% cotton as you can. TJ's asking, what about the Gore-Tex? Would it be protective? Gore-Tex, from my experience, hasn't been as breathable. I know it's a technical fabric, and it doesn't necessarily have any additional properties that TJ, I actually want to know a little bit more about why you're thinking Gore-Tex, but I don't think that it's not protective. It's just it has the filtration properties, but it's not a filter. So I think that that's the kind of the caution is, you know, it's easy to want to make things that are not filters, and I definitely want to talk about that. Give me just a second. There it is. So what I want to do is, so some people have said that polypropylene, this is actually good. I don't have any problems with answering questions because we only have 5 more minutes. So Dahlia is saying, I've heard that polypropylene, what some eco grocery bags are made from, is a good material. So polypropylene is what, the hydrophilic polypropylene is what a lot of the masks are made of. However, they don't have filtration, which is really where you get the value of protecting from the virus. A lot of these are going to just restrict breathability. And so not all the polypropylenes are the same. So this is another thing where I do want to talk about this briefly before I answer Allison's question about silk. The issue that we are seeing across the filtrations, and this is something that we've been doing extensive research on with our material scientists, is some of these filters that people are using in their home setups are dangerous. And so what we don't want to do is we don't want to over recommend, hey, everyone go out and buy this one particular filtration piece, but we also want to offer just a word of caution that everything that you have in your home is not suitable for you to breathe through. Okay, so like some of the HEPA filters have fiberglass. And so what we don't want to do is introduce another problem that you don't have by trying to protect you from a problem that would probably be solved if you stay home. So what we want to do is make sure that when you do go out, that you are moderately, appropriately covered, but that you're not inhaling things like fiberglass or other residues that were not meant for breathing in. Like some people are talking about using vacuum bags. And so sometimes, it's just not, what they're made out of wasn't intended to go up to your face. It was intended to go to a vacuum. And so you have to kind of think about those things whenever you want to insert pieces that are supposed to help with filtration, and make sure not to inhale things that are not designed for your lungs. I hope that makes sense. We really just want you guys to stay safe. And I understand everyone needs to, this is an all hands on deck kind of experience. And it's unfortunate that we've been put in this situation. We really wish that there had been more purchase of the right equipment from the beginning. But as there wasn't, we're in this situation where we're reinventing the wheel in a lot of ways and trying to substitute with things that are not appropriate. So what we want to do is, as we're substituting, we just want to do things that are a little bit safer. I did see the coffee filter one, Jill. I think that that's probably safer, but I don't want to completely co-sign because it hasn't been tested. And that's really the space that we're in, guys, is that a lot of these materials haven't been tested on human inhalation. And so when you're putting things up to your face, just be cognizant of that. I would read closely all of the ingredients. So if there's anything like formaldehyde or bleach or anything that's done to kind of improve the appearance or the functionality of what you're using, that none of those things should be breathed in. So fiberglass is one of them. Just be aware, like, read the ingredients on the things that you're purchasing or the things that you're using around the house so that you know what it is that you're introducing to your body. Sometimes there's chemical finishes that we just don't know about. And so what we don't want to do is to introduce that, because there's some things that are regulated by the FDA and other things that are not. And so what we want to do is, the cotton and being able to wash and rewash the cotton is probably the safest thing to have at your face for any prolonged period of time. That's not an N95 mask. But in terms of the things that are, I believe someone was asking about silk earlier. I think you really have to understand that it's really about, so silk is a protein fiber, and I'm going to try to spare the science, but really it's about how tightly woven is the material. Silk isn't dangerous really, in terms of, breathing, but again, it's, what are the finishes on the material? How is it, like those are the things that you'll want to consider. The cotton though, because the fiber of cotton tends to be a bit more lofty, meaning that it's just a bit more, think about a cotton ball. It's a bit more lofty. And so it actually has a bit more coverage in terms of the pass-through. Protein fibers tend to be very straight, unless it's wool. Wool is different, but protein, like if you look at a silkworm, it looks spindly, almost like a cotton web. So just be aware that that's something that you'll want to do. Any cotton mask, guys, before you wear it, make sure to wash it well. I know that probably sounds like a no-brainer, but be sure to wash it before you assemble it, before you wear it. It's really best to do it prior to assembly, because what will happen is that most cotton's going to shrink. And so it may fit you perfectly when you first make it. It's like fitting, so this is the key thing about fit. And this is pretty much the only thing I'll tell you about fit, because it's 10:30 already. Can't believe we've already blown through this time. But fit is primarily, you want to make sure that you have coverage. This is the tricky part, is over the bridge of your nose, through the cheekbones of your face, down around your chin, below your chin, because you want to seal as much as you can, and over the cheekbones and over again. So some people are using like the ties, whenever you go into the grocery store and you've got those ties that help you like close off your produce or whatever. Sometimes I've seen people use like 4 of those over the bridge of the nose together to be able to kind of help with the fit around the top of the mask. Some people are using different kinds of like small wiring, things like that. Pipe cleaners. I've seen people, insert things like that at the top of the bridge, just to help with the fit around the face. Because if you don't get the seal, there's really not, it's all kind of coming and going. So you're not really covering yourself. So what you'll want to do is to make sure that whatever you do is that you've got a nice seal. You can do some of that in the actual cut and design of the mask. You'll see some of these masks that have the shape where it kind of comes up to the bridge of the nose and comes out. That's good, and then it'll do the same thing around the chin. It'll kind of curve at the bottom, which is a good design. So what you'll want to, so the thing that makes it a good design, a great design, is adding a little bit of reinforcement over the nose. And then someone had asked about actually what happens if I don't have elastic, but I need to secure it to my face. You can do the same fabric that you use to make your mask. And really all you're gonna wanna do is take a strip of material, you're gonna fold it in half, and then you're gonna fold the edges over one more time so it looks like a book fold. It's gonna literally do like, you're gonna fold it in half, and then you're gonna fold it again, and then you're gonna sandwich your material. So we'll send out a picture of what that looks like. But basically you'll just do a self-binding, a fabric binding that can then be tied behind your head and tied kind of behind your neck, at the nape of your neck. So hopefully that helps you with understanding other options of things that you can do. Oh, TJ has a question in the chat. Let me see. So do you have any plans to use the ACC equipment to produce masks for the medium risk group? Very good question. So all of our projects for the incubator go through our emergency management through the college. So we're not at liberty to take on individual projects without first going through emergency management with the college. However, our plan is to do all of the low human contact, higher yield activities, which means that we're going to be using our Z1 cutter, which is a Gerber piece of equipment that we have in the design lab that is really something that can function with like 1 or 2 people running it. And it's really one large cutting table that can cut a pair of jeans in about 30 seconds. So we're able to cut goods, cut material in the shape of mask or, hats or gowns or what have you, and then provide cut goods to stitchers. Unfortunately, outside of some specialized equipment, we're really not going to be able to set up a clean room environment to be able to set up kind of a pseudo factory in the design lab. The reason being is because we're not really able to confirm protection of the people who are working there because we don't have the technical capacity to manage that. So in a normal environment where, we're not fighting a global pandemic, we would be able to use this as kind of a small batch, manufacturing. But in this space where the college is going to have to take responsibility for, understanding if people are actually sick or asymptomatic, and then potentially trying to figure out how to maintain social distancing and effectively using all the electricity. Like there's a lot of other components to that. But what we can do and what we are working on currently, the projects that we are taking on currently are cutting materials, cutting fabric for people who are stitching masks together. So I can't talk specifically about the projects until after we've completed them, but do know that we are using the design lab to help get materials to stitchers to be able to create products. So there's going to be a lot more of that coming in the future, but that's what we're able to do. Are there any other questions before we go here that I should grab onto before we sign off? It's 10:35, so I want to be mindful of you guys' time. So again, guys, if you are not on our listserv already, first of all, thank you so much for joining us. We're really, we understand that there's a lot of things that are going on right now, and that everyone's trying to understand how do we do our business, how do we, manage ourselves in this very uncertain space, uncertain time. But we really want to continue to bring value, and we need to hear from you what it is that you need. So definitely send us an email. If you don't hear back from me specifically, you'll hear back from someone on our team. And we are definitely putting all of that information together and aggregating all of that and helping to create content based on what you're talking to us about. So know that you are driving, what it is that we do and what we are providing to you going forward. So virtual learning is really where it's at right now. So we won't start this Wednesday. It'll be the following Wednesday. But this Friday, we're going to be doing our first ACC Presents. This is going to be it'll be a surprise guest because we will kind of let you know who that will be closer to. But definitely join us back on Friday from 10 to 10:30. And we look forward to catching up with you guys soon. So again, follow us on our social handles at ACC Fashion Incubator. You can find us on Instagram. You can find us on LinkedIn. You can find us on Twitter and Facebook, and now YouTube. So we're here on YouTube Live. And then you will also be able to join our mailing list and get any of the updated information. At some point, we will be sharing some additional technical information as well as links to articles of what's happening in the fashion industry. So be sure to send your contact information to fashion.incubator@austincc.edu to get added to our email list. So we look forward to it. We can't wait to answer your questions, and we'll talk soon. All right. Oh, Kirk Kirkland, if you're still here, let me answer your question quickly. Do know that ACC administration is helping to provide face coverings to ACC staff. I can't tell you much more about it right now, but it is in the works, and the administration knows that ACC essential staff needs face coverings. So we will be providing additional information about that going forward. So thank you, Kirk. I didn't mean to leave out your question earlier. We saw it, it's important. But the administration knows it's needed, and they are addressing that. So again, fashion.incubator@austincc.edu, and we will see you guys on Friday. All right, thanks. Talk to you later. Bye.